Along with the free healthcare providers, we have the public sector units like the railways, the power grids, the Coal India, the ONGC, etc., having their own hospitals, which more or less provide the same level and equity and quality of healthcare services to the same strata of the society. And at the third point, we now have the governments, entering into a certain relationship with insurance companies like the Star Healthcare, etc., and the government providing their own healthcare cards to the population, which is again near or below the poverty lines, to be able to avail free healthcare through the private players. So there is a certain duplication or even triplication of spending for providing the same healthcare procedures to the same population of our society, while those at the other end of the spectrum avail no benefit in terms of either subsidies for land and building, no subsidized loans from the banks. They get money at the same rate as any other businesses. They have the same taxation, the same rates at which they pay for electricity, water, essential services, etc. And again, as is our initial and age-old mindset, we believe healthcare should be a service. It should be free, and whatever you pay is always with a pinch of grudge in our minds. So this is leading to a certain chaos and dissatisfaction in the society, both at the higher end of the spectrum, where people feel they are being cheated when they avail private healthcare, and the private healthcares at the same time, most of them they barely survive. We have seen a lot of hospital systems being sold out in the last 5 years, if you look at it carefully. And on the other end of the spectrum, when people go to government hospitals, they feel not being cared for. They feel a certain lack of quality and accountability in the services that they provide. So there needs to be a certain coming together of these factors. We have to learn from what the people feel, what the other systems have evolved into, and we will have to come up with our own unified healthcare provisioning system, where I presume that the way forward would be that over time and a finite period of time, which should be staged in terms of the milestones that the system will come up with, where the government, from being a direct healthcare provider, should be somebody who will enable healthcare provisioning through enabling the consumer. We have various ways in which we know every individual's socioeconomic status, their vocations, their average income level, and thereby the government, instead of directly spending into these white elephants, where you have no idea about the cost of the procedures and the consumer satisfaction levels, to enabling them to avail the same services in a stratified set of service providers which are available across our society. And this will lead to a mature healthcare infrastructure which is able to provide care to the lowest stratas of the society, to those who can afford the best. And this is what will eventually lead to a superior quality, a superior accountability, and a healthcare infrastructure system which will actually become comparable to the best in the world.